My name is Jim Allard, and I grew up in Yarmouth, Maine. I work as a chief nursing officer at Medical City Arlington in Dallas, Texas. I had the opportunity to go back to nursing school after being a paramedic for many years. I recognized I wanted a more stable profession and I wanted to have more time with my patients. I came to Texas in 2001, and that's where I've resided since. When I came to Texas, I moved into a pediatric transport team role where I would go out by ambulance or by helicopter as a nurse and stabilize children in smaller community areas and bring them back to the Houston market, to our pediatric intensive care unit, so that hopefully we could heal them and get them back home. Furthermore, I moved to Dallas in 2004, and I had the opportunity to manage a pediatric cardiac intensive care unit at Children's Health. In that time frame, I really grew my leadership skills and recognized I wanted to be a chief nurse one day. So I had the opportunity to go back to school several times. I would do a degree and then I would work some more, and then I would do a degree and I would work some more. So I kind of did it piecemeal over 17 years. And then I had the opportunity to move into an assistant chief nursing officer role and then a chief nursing officer role. And so in my current role, I've been a nurse now 25 years. I've been in my current role about 8 months. This is my second chief nursing officer role. And in this role, I really have oversight of nursing for the entire hospital. So I really got into pre-hospital care because I had a dream as a third grader. I wanted to know what was going on in the back of an ambulance. And so a friend of mine and I partnered when we were in high school and talked to our volunteer rescue for our town. And we said, how can we help? At that time, we were 16 years old. And she offered that we submit a letter to the town council and ask them if we could create a student rescue to help support the adult rescue when they had a hard time getting volunteers to staff the ambulance. So this proposal was accepted by the town council. They created a student rescue, and then 6 of us became the first student rescue for the town of Yarmouth, Maine. And so that led me to really recognize that I didn't know as much as I wanted to know as I cared for patients. And I would get a lot of sick kids, and I would fear sick kids because I was afraid I didn't know enough. So when I graduated high school, I immediately looked for a paramedic program. I really honed my skills, became an expert as a paramedic, and then I thrived on what was next. How could I spend more time with my patients? How could I learn what happened to them after I left them at the emergency room? And so with that, I decided to go back to nursing school. I knew at that time I wanted to be a pediatric critical care expert. So that's the path I took once I became a nurse. And there are nursing programs across the country. There are associate degree programs, there are bachelor's degree programs, master's programs, and doctorate programs. And they do make it easier to also transition from paramedic to nurse, a lot easier than what it was when I went through the programs. Like I mentioned earlier, there are many ways to get to your final outcome being a nurse or being a paramedic. All of which are going to help you care for people. Know that when you go into nursing school, you don't necessarily have to pick a specialty, and don't force yourself to pick one. As you go through clinicals, you're going to find areas that you're drawn to, whether that be behavioral health or whether that be emergency medicine, or maybe that's critical care, or maybe that's home health, because I also was able to do a community health rotation. And so let that time draw you to where you want to move once you become an RN, and you can work in that space. And then if you feel like you're not challenged and there's another opportunity you want, then let's move you to another area. Maybe it's labor and delivery. Maybe it's the emergency room. Maybe it's critical care. There are pathways within the hospital to advance as a nurse, as well as further education that you can go into to become a nurse practitioner. But these decisions don't have to be made at the very beginning of your career. Those can be made as you get experience and then as you decide where you want to spend your time for the next area of your career. So I hope this helps you as you consider professions as you move through high school and decide what you're going to do next.